Are you one of the millions of people who suffer from sleep apnea? If so, this video is for you. I've had friends who have suffered from this condition, and it can impact almost every aspect of your life. In this video, we want to talk about what it is, why it happens, and how you can work towards stopping it. Keep watching and you'll find out what you can do to make sleep apnea less of a problem in your life. Once you're sleeping properly again, you'll be able to enjoy the challenges that life throws at you. You can appreciate the little things instead of being too tired to notice. Heart and circulation. It should come as no surprise to you that our heart and circulatory system are vital for making sure each cell in our body has all of the oxygen it needs to thrive. There is a reason you'll be dead very quickly if you ever get shot in the heart. Without the heart, there is nothing to make sure your cells and organs can perform their functions. Our bodies are very fickle things, and if the slightest detail is off, we don't work the same. When sleep apnea causes you to have problems with your heart and circulation, it will most of the time cause you to feel tired throughout the day. However, it can also come with more severe problems. You can develop coronary heart disease, and your risk of heart failure will go up. You're at an increased risk of having a stroke, and your blood pressure will be much higher. Now, should any of these develop, you'll need to take medication, and in the worst possible scenario, they could even end up taking your life from you. Mental health. I've always said that we have three healths: mental, physical, and financial. It's vital that we take care of our physical health, but it's equally important that we make sure our mental health is good too. Even though we are using all of our organs all the time, the only one we will have regular communication with is our brain. When our brain is unable to perform its functions properly, we can spend a lot of time being sad, upset, and angry. It's much easier to get work done when we have pain in our chest or stomach rather than when we are going through a difficult time with our mental health. When sleep apnea keeps you awake at night, your brain will not have been able to repair itself when you go to sleep. As a result, you're more likely to experience mental health issues such as depression and anxiety. Having problems such as these can cause you not to have a social life, not put any effort into your work, and make your life a bit miserable. Statistically, people with sleep apnea are also more likely to be involved in a road traffic accident or an accident at work. Real quick, are you getting any value? If yes, give this video a like. Make sure you subscribe and leave a comment below too. Now, where were we? Right, how does sleep apnea work? Now, let's get on to the science side of things. How does sleep apnea work? When we sleep, our upper airway relaxes, allowing the air to go in and out of our bodies without our lungs needing to do much work. However, when you have sleep apnea, your airway will narrow or even collapse. You will usually fall asleep, but not be able to stay that way for much longer than 10 seconds before our body shocks us awake. This can happen hundreds of times a night, and we wake up in the morning not remember ever having woken up. So what are the symptoms of sleep apnea? If you're worried that you might have sleep apnea, there are a few signs you could be looking out to decide whether or not you want to talk to your doctor about it. It's not uncommon to snore. However, when the snoring gets beyond a certain volume, this could have something to do with why you're tired so often. If you wake up with a dry mouth and or a headache, it could be because your body could not repair itself while you were sleeping. And having mood swings throughout the day is another sign of a mind that's suffered from sleep apnea. So who is likely to get it? Anyone at any age could potentially get sleep apnea. However, men between the ages of 30 to 60 are more likely to get it. Whether this is due to more lifestyle or genetics is up for debate. Other people who are more likely to suffer from sleep apnea include overnight people and those who tend to be heavy smokers or drinkers. But even if you live an incredibly healthy lifestyle, sleep apnea can also be genetic. It could be worth talking to your parents about whether anyone else in the family has ever suffered with it. Particular medication can also increase the risk, as can sleeping on your back. So how do you treat it yourself? If you wanted to try and sort it out before taking it to your doctor, there are steps you can take to get your airways working correctly. Firstly, if you're overweight, there are various reasons you should be working on sorting that out, but sleep apnea can be something else to add to your list of weight loss motivation. In the evening, try to not drink or smoke too much. And if your problems are caused by medication, try finding alternatives that don't contribute to your sleep apnea. What your doctor can do, if you've tried to deal with it yourself but you're still experiencing the symptoms, it might be worth talking to your doctor. They give you advice and/or medication to help with your body specifically and enable you to get a good night's sleep. Your doctor will be most likely to figure out the root cause of your problem. Some of you will want to go to your doctor right away, while others will leave this to the last resort. But whichever one you choose, don't be afraid of speaking to your doctor if you feel the need to. Sleep apnea versus insomnia. If you feel tired throughout the day, but none of the symptoms sound familiar to you, there's a high likelihood you don't have sleep apnea, but insomnia instead. Although the long-term consequences are similar, the difference is the cause. Sleep apnea is a physical health condition, whereas insomnia is usually more to do with mental health. With insomnia, the body will function the same way as it does with a healthy person. However, it will usually be your mental health that keeps you awake at night and prevents you from getting to sleep. Would you like to master sleep and become more productive, reduce stress, have a better quality of life, lose weight, optimize your sleep, balance your emotional state, improve your mental health, learn how to wake up feeling refreshed and energized, or learn a 5-step formula for better sleep? Then click the link in the description below the video and sign up for a free masterclass with the world's #1 sleep doctor. And the cost of this masterclass? Nothing at all. You can improve your sleep without it costing you a penny. Your body and mind will thank you for it. Thank you for watching our latest video. If you believe you have sleep apnea, the quicker you start acting on it, the lower your risk of the issues we've talked about. If you found this video to be useful, make sure to subscribe to our channel. We provide regular videos on healthy sleeping and making the most out of a good night in Slumberland. If you believe you have insomnia, check out this other video we have all about dealing with it without using medication. Thanks for watching and happy sleeping!